Lesson 2, contraindications, danger zones of massage. This is very, very important. You will be tested on this. Massage contraindications. What does contraindication mean? What do you think contra means? Opposite, against, contra, don't do. Contra, indication. Indication simply means to inform. And a contra, against, indication is this disease, that condition, this problem. It's an indication, contraindication. So, what does it say? Total contraindication. What does total mean? No. Do not massage at all. Okay? Are we on the same page? High fever, infectious or contagious diseases such as typhoid, malaria, diphtheria, influenza, TB, tuberculosis, AIDS, okay? Other conditions that you can get sick from. You, the massage therapist. Under the influence of drugs or alcohol? Oh, you've been drinking. I can smell it on your breath, Mrs. Kumar. And that's a little joke in our class. I think Marjana knows. Everybody I work with is either Mr. Kumar or Mrs. Kumar. That's a little joke we have. Recent operation of acute injury or shock. Acute injury. Oh, no. You've been in a car accident, you have a sprained neck, a broken arm, your pelvis is broken, your leg is... No. I'm sorry, Mrs. Kumar, Mr. Kumar, I would really like to help you. You've not been referred by a doctor because the doctor will not refer you when you're that bad. I know. I can take insurance from the doctor, just like, because I'm like a doctor of massage. Licensed massage therapists take insurance, just like a doctor. And the doctor refers them to us, and then we can charge big money. It's very nice. You can get big money if you're a licensed massage therapist. You know, in the US, 50 to 75 US dollars is a normal massage. But if you're under insurance, you can go anywhere from $125 to $250 for a 1-hour treatment. Let's see, what's 250? That's 17,500 rupees for 1 hour. Would you like to make that kind of money? Yeah, you wouldn't mind that. I'm glad to see you're laughing. That's pretty nice money. So, in any case, we are here for spiritual reasons. We're not here to make lots of money. Do we want you to make money and survive? Yeah. Yeah, we're going to talk about how to do all that. But we're not here to become rich. We're here to spread the gospel because God has called you. You remember my message this morning. Please don't forget it. Very important. God is calling each one of us. Okay, neuritis or neuropathy. You're going to hear a testimony from a lady on our campus that her legs were getting all black here. And you're going to hear a testimony from her of us working with her. I won't say any more about it. Infectious skin diseases and conditions such as cellulitis, impetigo, that's a skin infection caused by bacteria, Staphylococcus aureus. I have a gal right now in Canada. Have you ever seen a young girl, and this happens more with you girls, almost hardly with men, but more with girls, men do get it. When you have your period, it's worse, and their face is all pot-marked, like little dents and little, we call it hamburger meat. Their face is kind of swollen a little bit, and it's all, have you ever seen that? Have you ever seen usually a girl, and the face isn't nice, not all smooth like your face. It's got all these little pot marks, and there's lots of them on both cheeks, okay? That's a staph infection. And I have a special program, a special natural medication that clears that right up. The first girl I did this with, I looked at her and she said, Dr. Daniel, we've spent 3,000 US dollars. 714, that's 210,000 rupees. That's a lot of money. 2 doctors, and I'm no better. And I said, did they tell you you have a staph infection? I said, they're just bleeding you. You heard me talk like that. What does that mean? If I bleed you, I'm just keep taking and I keep taking and I keep taking and I keep taking. It's a bit of a cliche. Cliche are all the phrases we talk in, you know? Like we talk in a phrase that doesn't mean what it means, okay? And so they're bleeding her to death, taking her money. You keep coming back. I want to keep you as a patient for the rest of my life. No, I want to see cure. And I said, this product's going to cost you about $80, 6,500 rupees, 6,500 rupees. She bought 2 bottles from me. Her face is clean. She is one happy camper. She's a very beautiful girl. She's married to a very nice man. They have 2 little babies now. But her face looked awful. And she was embarrassed. Why? Because look at my face, and you girls look at your face in the mirror and you say, who would want me? Look at how ugly my cheeks are. Well, my heart goes out to you girls. I don't want you to feel that way. And so I said, these doctors are taking advantage of you. Are you hearing me? I was told I need to talk louder. And so I don't like it when I see a doctor taking advantage of someone. There's cure. We can get cure. But these guys were just taking their money. And so we changed that. Okay. Okay. Last one, serious dehydration. Do you know how many problems can be cured? Ameliorate is fixing, making better. It's a big word, ameliorate. Just by hydration. I'm going to tell you stories about myself. I'm a real open person. You say, you're so open. You're going to put your hand over and I would never be that open. But I am. Does it bother me? No, because it's all medical and you're going to be learning about medical. Okay, local contraindications. What does it say? May massage the patient, but not the area affected by varicose veins. Varicose veins are painful. Do you know varicose veins? Yes? How many don't know what varicose veins are? Okay, good, thank you. I'm glad you said something. Okay, let's see. You could say a vein that's sticking out, and it actually sticks out, but it starts to bulge a little bit, and you can see it maybe where it makes a turn, and it becomes hard. And then the body has to use another vein to get through. This is like hardening of the arteries, but it's not. Varicose veins is where the epithelial cells that line the veins have become rigid and they're inflamed and they're not flexible. And so that may not be a perfect description, but varicose veins stick out all over, and you don't find them on your arms, by the way. They're always on your legs.
It will be in black colors.
And they can be a little black, darker in color. And maybe some of you, maybe Beulah has some and she can show you. You don't have any. So maybe if you're the oldest one here, maybe there's someone that may be in your 60s or 50s. I don't know all your ages, right? Beulah and I are in the same decade. And so if you're in your 50s or 60s, you might have varicose veins, and it shows on the surface of your skin because arteries are internal and veins are superficial. Remember, you're going to be tested on that word. Superficial means on the surface. And so varicose veins are painful because the blood flow isn't moving and the vein is becoming stiff and problematic, okay? Undiagnosed lumps or bumps. Oh, Dr. Daniel, I've got this lump right here. Oh, well, I think it's a knot. Now, we don't massage the breast. Just remember that. If a lady were to ask a man to do that, they have to sign a paper. In this country, you would never do that. But in America, if there's a lump here, and I've had ladies ask me in a restaurant, I never signed a paper, but I wasn't massaging them, and she's the nurse, and she said, my breasts are like clay. I said, you're kidding me. I said, you're in trouble. She said, how do you know? I said, because I work with this all the time. And she asked me to feel her breast, so I felt both of her breasts. And I said, you are in big trouble. Her husband couldn't see anymore. He was almost 100% blind. And I said, you need to get on hormone, bioidentical natural progesterone, now, right away, or you're going to get cancer in both your breasts. You are in serious trouble. But I don't usually have this happen to me. And so, I mean, I'm not interested in doing any of this anyway. But the whole idea is, where are you going to get lumps? Under the armpit for you ladies, lymph getting swollen, down in the lower abdomen, okay? So if you're massaging a woman and she says, I have a lump here, it's usually lymph. Is it always? No, you don't know. So do you massage there? No. You tell her, Mrs. Kumar, I think you need to go to the doctor and find out what the doctor thinks. If they do a biopsy and they stick a needle in there, it opens up the cancer, if it's cancer, to the whole body. So am I positive about this kind of stuff? Not too much, because I will tell you the truth and the doctor will not. But sometimes you can do, ultrasound. And you can do something, maybe an x-ray, and you can find out. But always avoid needles and the doctor sticking you and trying to get stuff out of you. Why? That would be your last resort. Always resort to something safer, okay? You just want to be safe. I want to protect the ladies I work with. I'm not careless. You know, careless? I want to protect them. Okay, pregnancy, you can massage, but you're probably not going to massage this area. Hernia. You all know what a hernia is? There's got to be someone that doesn't know what a hernia is.
Intestine disease. Disease on intestine. Intestine we have there. On that part, yes.
There's different kinds of hernias, and they're all here, okay? I mean, they can be in other places, but this is your average, 95%. A hiatal hernia is where your stomach has a little thumb and it goes up into your diaphragm. There's a little slit in your diaphragm, and when the food goes down and you overeat, and you look at a diagram on a book or on the internet, you'll see it's like this little thing, and it gets a little bit wider at the top. It's almost like a thumb. You see my thumb is narrow here, and it's wider up here. Well, that's a hiatal hernia. But if you have a hernia, the hernia simply means that you lifted something heavy, the sac got a tear in it, and now your intestine is coming out. And if your intestine, your small intestine, is coming out, and you get a kink in the small intestine. Do you know the word kink? Okay. See this finger? If I go like this, that would be a kink. If I take a water hose and I fold it in half and I squeeze it, and I squeeze it real tight, the water doesn't go out. That's a kink. K-I-N-K, kink. And if your small intestine comes out of a little slit, you got a hernia, and it kinks, you're not going to pass any fecal matter. Do you know what fecal means? Poop. okay? It's liquid in your small intestine. It's drier and more formed in your colon, right? So you have a small intestine, and then you have a ascending colon, a transverse colon, and a ascending, a sigmoid, and a rectum. Rectum's right back here. Okay? So, I hope I'm not embarrassing any of you because this is medical. So I'm going to be talking about things that you might be a little bit over.
No.
Don't worry about it. It's going to be like this for 4 months. You want to know about medical? I'm going to be talking about medical. I'm a naturopathic doctor and a licensed massage therapist, a depression counselor. Lorna is also a depression counselor. We've worked with dozens and dozens of depressed women, and we are real good at what we do. And we're going to share that with you. So you get to benefit from 25 years of knowledge in 4 months. So realize, if some of the things I say you feel a little embarrassed over, we say don't sweat it, right? Don't sweat it. Whoop. So here we are. Don't worry about it. You're going to be your learning curve. Hernia, broken bones and sprains. That's pretty simple. Undiagnosed pain and severe headache. Yeah. Why do you have a severe headache every day, Mrs. Kumar? Why do you have a headache every day? We need to find out. It could be adrenal dominance. It's the brand new book I just read. Really exciting, sister. Really exciting. I'm making progress for the first time in my life over chronic frontal lobe headaches. Do I know how to solve a trapezius? How many of you know the word trapezius? No? Remember? Trapezius is the muscle that comes up here and goes down, and it comes to a V right here in the middle of your back. And that muscle is right under your skin. And that's a tight muscle. And when you look at severe headaches, and I massage the back of your head here, I usually ask permission to touch you, and we work this and all through here, we can release all that tension, and I'll teach you how to do that. There's a few little special techniques on how to do that. It's wonderful. I make real progress with headaches in the back. But frontal lobe is where your artery overdilates. I still haven't figured that out. Maybe you can help me with that. But you overdilate on the right side and you get a frontal lobe headache. For the first time in 25 years, I'm finally solving that problem. And it's from this book I got from this doctor. And it works.
If you don't drink proper water, also you get.
If you don't drink proper water, but this woman drinks proper water. She's a good water drinker. I happen to know her really well. Okay. Inflammation, including arthritis. We're going to talk about rheumatoid arthritis, autoimmune, and arthritis. How many people are chewing betel nut? I see them in India. And they were everywhere in Thailand, up in the mountains with the Quran. They're not drinking water. They have arthritis. You have a sac in here. And when it all dries up and the synovial fluid isn't there anymore, you get pain. It's a no-brainer. You start drinking water, you don't get relief right away. It takes several weeks for the body and the damage to ameliorate. High blood pressure, lightly massage only. Skin problems such as wounds, bruises, burns, boils, sunburn, blisters. What does it say? Massage not in the area affected by all of these. You're going to get a test on this. And you've got 1, 2, 3, 4, 5, 6, 7, 8, 9. And on the test, I'm going to ask you to give me 4 out of the 9. You need to know this. Why? You can't be working with someone and getting in trouble with the law and getting a lawsuit. This is serious stuff. Learning massage is wonderful, but you need to be smart about it. If you're going to have a house and you're going to bring clients in, you need to really know your stuff. I'm going to help you to be an expert because I want to see you successful. Medical contraindication should be approved by a medical professional before giving massage. Cardiovascular conditions, thrombitis, phlebitis, hypertension, heart conditions, angina, pacemaker patients. Tick, 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 tick. Pacemaker. Acute inflammation such as appendicitis. Where's that? You know where your appendix is? If you don't know, you're going to learn. It's right here. Right? Your appendix. Right here. And that appendix then goes into your small intestine. I'm sorry, goes into your colon. So where the small intestine attaches to the colon, you have your appendix right there. You're going to learn about that. Acute inflammatory condition. Okay, I already did that. Appendicitis, cholestasis, pleurisy, osteomyelitis. Those are big words. Psoriasis and eczema. If you have psoriasis and eczema, it's going to show. You're going to see it on your skin. You're going to see it on your face. Osteoporosis. I am very successful, 100% successful with osteoporosis. But it takes about 2 to 3 years to completely be over osteoporosis. You have minor, that's the beginning. Then you have 99 to 199, that's mild. Then you have 2 to 2.99, that's medium. And then you have 3, 3.0 to 3.99, that's severe. And on my program, my patients in 1 year make almost a whole point improvement. The doctors can hardly believe it because they can't do that.
Giving the food, correct food and make
It has to do, I'll just make it simple. It has to do with if your blood is acidic, the body's going to pull calcium carbonate out of your bones to keep your blood within the, 3.45 to 3.75. Am I saying that right? 3.45. 3.45 to 3.35. Do you remember, Rebecca? Is it 3.35 to 3.45 on your blood? So there's a little window for blood. Remember, your urine, your saliva, the pH is different, but the pH in the blood is a narrow window. And when your pH is too acidic, you could die. So the body immediately pulls calcium out of your bones. It's usually your hip cage, your ribs, or your vertebrae. One of those three. That's about it. One of those three. And to alkalinize the body. And so I've just figured out how to do all this. But in any case, when you're looking at osteoporosis or osteomyelitis.
What are the conditions available to acidic, doctor? In what are the conditions available?
When you're too acidic, you're usually eating meat, dairy, and cheese. And when you're too acidic, you're not drinking enough water. And when you're too acidic, you're not eating the right kinds of foods. You're eating junk foods, okay? And you're eating hot foods like hot peppers. And then you can be overweight, so you're not getting nutrition. If you eat food at night, and you eat at 10 o'clock at night or 9 at night and go to bed right after you're done eating, you're actually taking all the carbs, carbohydrates, putting it into fat, and you're actually coming down with malnutrition. Remember, malnutrition, mal is against. We have all these words, contra or mal. Malnutrition is bad nutrition. So you're not getting the right calcium and you're not absorbing it. Why are you not absorbing it? Because you're under ultraviolet lights and you're not getting out in the sunshine. And so the body comes in, you know, I have ladies and I tell them something. I'll tell you this later because I'm saying too many things. I'm talking too much. I'm real good at that. And I tell them, you need this substance because you have bad digestion. And they refuse to get it from me. That's when I used to sell them supplements, natural medications. And I get a call from them 4 to 6 weeks later. And what do you think they say? I have bone spurs. I have bone spurs. And I'll say, do you remember me saying that you have bad digestion and you need this particular substance? Yes, I remember, doctor. I said, well, now you're getting the fruit of not following my directions. I don't say, I told you so. Choo, choo, choo. That's mean. You don't say, I told you so. That's a slap in the face. You don't do that to a client. Just remember that. You don't exercise pride. No pride. You're always kind and gentle with your patient. You don't say, I told you so. No, that's a put down. They made a mistake. They wouldn't listen to you. So you're still nice. And say, well, Mrs. Kumar, I was afraid this might happen, but it's okay. We have a solution. So I mentioned we should do this, so now we'll get to do it. And then I tell them what to do and how to do it. And with 1 month, all their bone spurs are gone. You know, if you go to the doctor, they want to operate on you? Yeah, because the doctor, the surgeon operates, the radiologist is going to radiate you, and the oncologist is going to give you poison. Poison, cut, and burn. Poison, cut, and burn. We don't have to do that. There's a better way. So that's the basic idea. Okay. Psoriasis, eczema. Okay, edema. You ever talk with a lady? I don't get this with men, and they're all puffy down here. Well, there's things you can do for that, but that puffiness is lymphatic buildup, and you need to move it. And you say, oh, Mrs. Kumar, I think we need to get you on the table and give you some lymphatic drainage and massage. And we can correct this, and we'll get your diet and correct that. By the way, would you like to sign? My name is Mrs. Sundari. No, I didn't say that right. Sundari. Sundari. My name is Mrs. Sundari, and I know how to do this, and I want to help you. And this is our fee, and we can help correct this pretty quick, and I think you'll love it, and you'll be so happy that you came. You made the right choice coming to me. I do a little sales work. You have to do that. You be positive, you be confident, and you talk the right way. It's very important. Very, very important. Why do I do this? Well, because I've learned. God has been my teacher. You know, in America, I'm considered poverty level. Poverty level. But I learned by listening to God how to be positive, how to encourage people. And in the days when money was a little bit better, 1 month I made 700,000 rupees. And 1 rupees. Yeah, I'm converting it over so you get it. 700,000 rupees. That's a lot of money. I only did that 1 month. But how did I do that? Because I was helping women. 90% of my patients were women. I was giving them answers. But you know, you can give someone an answer and they get no results. They were all getting good results. I want you to have good results. Because we can do this. With God, all things are possible. We can do this. Okay, nervous or psychotic conditions. I've worked with psychiatric people. People who are schizophrenic and their struggle. No, I can count them on one hand. That's not too many. Because I'm not a psychiatrist. But the ones I work with all got well. So how do I know that? Because I've read 3 books that are from a man who was beat up verbally by his fellow doctors because He was doing things differently, not with drugs, and he was getting answers. And these people were getting well. And I read 3 of his books, and I'm copying what he's doing because he's smarter than I am. And so if I can learn from him, I'm just duplicating what he's doing. And I'm going to do that with you. Serious conditions such as stroke, epilepsy, cancer, AIDS, Bell's palsy. Bell's palsy is on the side of your face. You don't massage that. It's usually on the right side, but it could be here. Trigeminal neuralgia. So you've got this nerve, and it's an infection, usually with a virus, could be a bacteria, but it's usually a viral infection. Bell's palsy, right through here. And I've worked with this also. It's difficult to work with, but you don't massage this. And my girls, because most of my students were girls in Thailand, most of the girls, when I asked them, what's your favorite part of massage? You know what they said? The face. They like face massage better than anything else. I don't get it.
Even in India.
What's that?
Even in India also face massage.
Is that right? Yeah, well, face massage doesn't relax your brain. You know, it might make you go to sleep, but I'd rather have my back. Foot and hand massage will put me out. Like, it's great. That's what puts me out. But all the girls and even the 2 guys, they said they like face massage better than any other massage. And I was dumbfounded. Okay, but you know, that's what they told me. So I taught them how to do excellent face massage. Better than all the Thai. And I've had face massage from Thai, and they don't know how to do it.
Are you going to teach us?
I'm going to teach you how to do everything. And Rebecca's going to teach you how to do everything. And James and Simon, yeah. They're going to teach you how to do everything. Okay, flip the page. These are the places on the body you should avoid when giving massage. What is this first picture right here, number 1? Let's see if we can go through this quickly. What is it? Oh, our class is over.